guys, how are you doing? And welcome back to Dr. Bami's channel. If you're new to this channel, don't forget to subscribe, like, and share. And to my new subscribers, I say welcome. Thank you so much. Before I proceed, let me just introduce myself. So I am Dr. Bami Sola, and I am a licensed medical doctor. Let's dive into the video for today. Today's video is concerning the MDCN exam. I want to break down some things, also give you some rules and also some points, when it comes to writing the exam. Now, it's divided into two parts. There's the MCQ, which is the multiple choice questions. Now, the multiple choice questions can be really tricky. It's a way to assess your knowledge of medicine in general. So you have to read all your books, every material that you can source for. I would advise you to lay your hands on, major books in internal medicine, surgery, pediatrics, and ONG. Also, don't leave out ethics. Don't forget that there are picture test questions, okay? So I would say the picture test questions are more like, just something that you can slide with, okay? They are cheap. They are really cheap questions, and I would refer you back to the guide, okay? The guide in pediatrics, internal medicine, surgery, and obstetrics and gynecology. So you would find a lot of pictures, okay? And in those books, you would find the diagnoses of diseases, the indications, the treatment. So the questions are just going to be based on this. They're called picture test questions because you find a picture and then the questions are based on these pictures, okay? So manage your time very well. It's a computer-based test, right? So definitely if you don't know a question, you can move on to the next question. Don't waste time on a question you don't know. Go ahead and answer all the questions, and if you still have time, you can go back to the ones that you never answered. And remember, there is no negative mark. So definitely you can always guess. The exam is a bit easy to pass because even if you didn't do well in your MCQ, OSCE can make up, okay, for that. So now I'm going to talk more on OSCE because I feel OSCE is the tricky part, okay, because here you are dealing with patients, okay? So I would go step by step. So first of all, there are 10 stations in general, the 5 workstations and then the other 5 rest stations. Okay, so what stations are stations whereby you encounter patients, you probably maybe clerk a patient. So after each workstation, there is a rest station. Okay, so the rest station, you find a piece of paper with questions and then you answer and then you move to the next station. So the number one tip is going to be time, okay? Because at each station, at the end of the time, they ring a bell. And once the bell is being rung, you have to get up and then move to your next station, because if you don't go to your next station, obviously it's going to be empty. And then the person who is meant to be at your own station wouldn't let you be. So you see why you have to deal with time. You have to be time conscious and then you have to really write fast. So there's clerking of all systems in the guide for pediatrics, surgery, internal medicine, and obstetrics and gynecology, okay? So there are ways of clerking. But I am just going to say this because when it comes to clerking, sometimes you are clerking a patient and then you tend to forget some points. It doesn't have to be orderly, okay? Make sure you exhaust all the questions that you can ask this patient, because as you ask these questions, you are being marked by the examiner, okay? So when you strike a point, the examiner takes that particular point for you, and in that way you gain your points, and that's how you get to pass your exams, okay? So make sure you exhaust, ask all the questions, and secondly, ignore whatever the examiner is doing or the patient. One thing I need you to remember is this: these people have been stationed, okay? So they are more like models, they are more like mannequins, okay? You can't be examining a mannequin and then expect to get a reaction from a mannequin. It's impossible. So see those patients as mannequins. A patient will not give you any form of emotions, whether you are being on point or whether you're going off point. You as a practitioner should be confident. Even if you're asking rubbish questions, be confident in asking those rubbish questions. You never can tell, you could get a point for that. Just exhaust all your questions. And then when it comes to the examiner, sometimes the examiner wouldn't even mark anything for you. That might throw you in a state of confusion, and then deep down you're wondering, like, am I not asking the right set of questions? Just ignore, okay? These people are being tricky. It's an exam. They don't want to express emotions. All you have to do is to go ahead with what you have to do. Make sure you're time conscious, exhaust your time, and that's it. And after each time you click a patient, always remember to say thank you. And before you click a patient, remember to introduce yourself, because it is very important. The patient should get accustomed to whosoever is clicking him or her. Thirdly, don't forget to introduce yourself and also thank the patient after clicking. Okay, so that will be all on clicking. Definitely when it comes to clicking, you might be told to click a patient who has goiter, a patient who has bronchial asthma, anything whatsoever, or a patient who has hypertension. Definitely these are very common questions, or even diabetes. So you have to do your homework by going through clicking of all the systems. So now the main part of OSCE, which is a very tricky and fun part, is the clinical examination. Okay, now it's an exam, you are tensed, okay? But I always want you to remember one thing: whether you are tensed or not, make sure you do things the right way. And that is where this video really comes to play. And these are the points I really want to highlight in this video. The first thing that you have to do immediately you get to your patient, always remember to stand on the right hand side of the patient. That is the first thing to do. If you don't stand in the right position, automatically, whatever, even if you examine the patient the right way, for the fact that you already stood in the wrong position, that renders everything you've done invalid. So you can just imagine all the points you would lose. So the first thing to do is to always stand on the right hand side of the patient, okay? You get a point for that, and that is the beginning of your clinical examination. Okay, so after standing in position, the next thing to do is to introduce yourself. Oh, good day, ma, good day, sir. I am Dr. blah, 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 and I am here, to carry out this procedure. Enlighten your patient on what you want to do. Everybody has a right to know whatever is going to be done on his or her body. So explain to your patient, okay, and then let him know, oh, this is what I have to do. I am here to do this. Yes, you could feel a bit uncomfortable, but be rest assured that you are in safe hands and nothing will go wrong. And if you have any questions, don't hesitate to ask me. So after your introduction to your patient, the next thing to do is to seek consent. Ask for permission. Am I allowed to go ahead with the procedure or with the clinical examination? If she says, or he or she says, oh yes, you can go ahead. Oh, okay, thank you so much. And then the next thing to do is to get a screen. Now remember, it's a clinical examination. If you're going to be carrying out the complete or the full clinical examination of this patient, you will definitely reach the abdomen. You will definitely reach the inguinal region, and you don't just want to expose your patient. Screen your patient for privacy, because sometimes even a patient wants to tell you something. It gives you this one-on-one time to speak to each other, and also guarantees the confidentiality as well. So after you get in your screen, proceed with your clinical examination. Okay, remember, with your clinical examination, always carry them out systematically, okay? Because these are where you get your points, okay? So, like I said in my previous videos, I actually advised that you should try to enroll for a tutorial because they would teach you a lot. And another point that I would make here is this: for your clinical examination, try to practice as much as possible on people around you, on your friends, your family members, until it becomes, a known thing to you. Okay. And lastly, after examining your patient, allow your patient time to get dressed, okay, while they're still screened. And afterwards, thank your patient for cooperating with you, and then you take your screen away. And that's how you score your points for clinical examination, okay? So now the bulk of the work lies in your hands when it has to do with you clinically and also systematically examining your patient. You need to know from what system to move to the next system and all that, how to check for your lymph nodes. Lymph nodes too are done. Everything in medicine is done systematically and accordingly, okay? So that's all I would like to share in this video. And remember one thing, that as you are examining your patient, the right way, also be time conscious. Don't waste time doing what you shouldn't do. Even if you forget some things along the way, just go ahead and do others. You still score your points for other things. And always remember to be confident, okay? Because your level of confidence speaks a lot, because no patient wants to be in the hands of a doctor who fidgets, who is scared, okay? So you need to display this aura of confidence, okay? So good luck to you guys. So guys, that will be all for today, and don't forget to hit the like button, give it a thumbs up, and subscribe if you haven't subscribed, and share with your friends, okay? So till another time, have a great day, guys.